Okay, the recording has started. Thank you all for joining us tonight. We have a nice turnout here. Appreciate everybody making time to be here on a nighttime meeting. And I know some people were not able to make it, so hopefully you're watching this recording. If you are, feel free to follow up afterward with any questions. I know most of you. I don't know all of you, though, so I'll introduce myself, Justin Horvath. I'm the president and CEO of the Shiawassee Economic Development Partnership. Also joining me tonight as sort of a co-presenter who will follow up my comments will be Cheryl Peterson, the head of our Small Business Development Center. Cheryl, do you want to say anything before we get going?
Good evening, everyone. It's good to be with you and discuss this really key issue in our community for providers, for employers, and of course for the children and families that you all serve. So I'm glad to be a part of the meeting and hope to be a part of bringing a solution to our community.
Great, thank you, Cheryl. So a little background on why we tried to get this organized. So I do economic development for Shiawassee County. I'm head of a countywide private nonprofit. We work to attract business, grow business, start business, working in partnership with Cheryl at the Small Business Development Center. And over the last couple of years, talent and access to talent, hiring talent, retaining talent has risen to the forefront as a #1 issue for the businesses that we work with. And we identified there was a lot of reasons that were causing that to be a challenge for companies. Well, as you might imagine, that's become an even bigger barrier with the COVID-19 pandemic. And I think everybody watching tonight and watching the tape after would agree that the talent pool is a major, major challenge for companies right now. So many businesses are trying to hire and are struggling to do that. And there's a lot of reasons for that. It's a complex problem. But one of those is absolutely the availability and affordability of childcare, particularly, I think, in light of things like virtual schooling, where maybe parents are not able to be home or they have to be home with their kids and not able to go to work. So finding ways to address the childcare needs in Shiawassee County is very, very critical. And in our opinion, we want to try to do what we kind of do with our normal business operation, where we want to try to support our existing providers and hopefully those providers that are on tonight, and then, might be joining us once again, watching it later, getting good information out of this, access to resources to help their business. Certainly, if there are startup operations locally that might want to begin a childcare facility, that's a beautiful thing too. And then certainly if anybody wants to locate in our community, we always appreciate the attraction of new businesses. So it kind of dovetails a little bit with what we're doing. But in order to figure out a solution and how we can work with everybody and how to support our childcare providers, we felt like we needed to get a baseline of data before we took anything further. So I want to thank right up front our friends with the Genesee Shiawassee United Way, Cook Family Foundation, Shiawassee Community Foundation. We've had some other partners as well. Our organization was involved. Covenant Eyes was involved in supporting this as well, to do an assessment that would put some specificity to this need, to try to understand what the market looked like out there. So I'm sure many of you that are participating here, you're familiar with what the general needs are, the general issues are, but hopefully you'll get some interesting nuggets of wisdom here tonight that you'll be able to learn from. And so what I'd like to do is walk through that survey. And then obviously, if there are comments, questions as we go through this, please jump in. This is meant to be interactive. Once again, we do have people watching on video, but our group here tonight is fairly small. So I think we can certainly be conversational in our presentation. So, and you see here, we had a national child care provider do a survey Childcare, many of you are aware of them. They have many locations all over Michigan, all over the country. This is something that they specialize in, is being able to do these community assessments. I got engaged with them at an event a couple of years ago. We started a conversation, and ultimately it led to this. So just wanted to point that out, that that's who did the study. Survey results and then next steps. Got to make sure technology works. Okay. So I want to begin by saying we do look at this through a countywide lens. We know this is a countywide issue. We have providers, we have businesses throughout Shiawassee County that have needs in these areas. But for the purposes of the study, the focus was on the demographics of the Owasso area. So as you see here, there is population within a small range, within a larger range, and then up to 15 miles. So actually, Owasso within 15 miles really does represent Shiawassee County. In fact, it takes in a little bit more than Shiawassee. It gets in places like Chesaning. So that's why you see the population there is somewhere around 84,000. The county itself is only about 70,000. So it takes in that core area. And then here's some additional information regarding to not only household growth, but income. We know income is a huge, huge factor as it relates to childcare. And we'll get into some of that here in a little bit. Okay, so what we did, it was twofold. Number one, it was an employer assessment and it was a community assessment. So the community assessment was sort of an open survey process. It was promoted in many, many ways through media connections, email lists, social media. There were news stories on it. So really tried to make it very, very broad. So this could be businesses, it could be parents, just everything you could think of. And then we also worked directly with quite a few large key employers in Shiawassee County. So Memorial Healthcare participated, Crest Pontoon participated, Josh's Frogs, Precision Electric in Corunna. There were a couple of others. So it wasn't expansive in terms of, 100 employers, but a lot of our top key ones, because we really wanted to understand from the employer perspective, what the needs were. So what you see here is a breakdown of the ages of the children who participate in the survey. So we ultimately had, I think, total responses was somewhere around 300, if I'm not mistaken, of individuals. So through those individuals, there were 556 children that were represented in the survey, which is pretty, I think, substantial. It's really good information, really good data. So what you see here is a breakdown of the age ranges. And so fairly symmetric. It looks like 2 years old, 3 years old is sort of the larger one, but fairly even there. So this is really where it gets more interesting. So of those 556 kids that were represented in the survey, this is where the parents were paying currently for a licensed child care center. So as you see here, only 135 of that 556 were actually paying for a center. So they did something else with their children. Maybe they were staying at home. Maybe they were with parents or grandparents, things like that. So that is the slide here. And you see the breakdown by ages. Once again, good information for providers to understand, where those kids are in terms of age. This is interesting. So this slide represents basically where the opportunity is. So knowing that hundreds and hundreds of those kids, a large percentage of our child population is not using childcare today, where's the opportunity maybe to grow that, to actually get kids into a child care center? And you see here there is actually a fairly substantial number of those hundreds of kids that could go into a center. So there is market opportunity. And once again, what you see here is a breakdown of what those ages are. So that would be, I think a really interesting thing to note, that there's a lot of folks that are not in a center now or not in a good situation that could move to a new situation or move into a center, into a better situation. So I think that tells me that there is a need out there, and finding ways to get more slots available is definitely an opportunity out there. This is another factor that came up, and once again, the providers on tonight, I think, are definitely aware of this. So there's definitely a range of need out there. There's parents out there that need 5 days a week, morning to night, soup to nuts kind of thing. But there was also a really big demand for backup care. And so this is sort of that, oh boy, my current babysitter fell through, something happened, I gotta have a spot for my kids, or else I'm gonna have to call in sick, or I can't go to work. So this was massive, I think, to find these survey results out for the survey, that 50% of the people that responded, 50% of the kids would like to have access to backup care. And so this is important too, I think, where not only, having available slots for that, but maybe exploring ways that could be provided as a child care benefit is something of interest. So this is the rub, right? And I know some of the providers know this. It's easier to deal with a parent that has a kid for 5 days a week, 40 hours a week. It's harder to make it work when it's a drop-in like this. And maybe it's not needed on 1 week, maybe it's needed a couple times the next week, so it's not set in stone. It needs a lot more flexibility. That could be where an employer comes in and maybe provides some type of subsidy. So we're going to get into that a little bit more later as well. This is the pay. So I think we all know this is fundamentally probably the biggest challenge we have. Is many of our providers, many of our parents are not paying a lot to providers, and that makes it very, very difficult to operate a child care center when you're not making a lot of money. So this is the breakdown right now from that survey of what people are paying. So as you see here, 70% almost are paying less than $150 a week. 31% obviously paying more than $150 a week. So now clearly that does reflect maybe some people only have childcare 1 or 2 days a week. So they, of course, would be the lower amount. But I think, once again, many of us are aware that the per hour rate is not that high, and the per week rate is not that high. And that's creating challenges, I know, for many of our current providers. So we're going to talk more about that as well. This is a tuition by age group. So I am not an expert in this field. I'll be very honest. I know many of you know a lot more than I do, but what I've learned, and this is not surprising, the younger you are, babies less than a year or two old, obviously are going to be more expensive because there has to be more licensed people to watch little kids than you would a 10-year-old. So that's something to note here. So as you see in the note, lower rates for the older kids, higher rates for children less than 2. So this is the breakdown of what people are paying per week based on different age groups there. So there's that. This was interesting. So this is not satisfaction with child care centers. This is satisfaction with their current arrangement. So this would be, it could be centers, it could be, grandparents, it could be friends. I mean, I think we all know there's all different ways to deal with child care. But pretty remarkable that 36% were either neutral or dissatisfied. And once again, I mentioned this a couple minutes ago, that is opportunity, I think, to grow operations for centers because those folks are looking for something that would be better than what they have now. Once again, this doesn't necessarily show any disfavor with current centers. I actually believe it probably represents more of they're not in a center. They'd love to get their child into a center. So they're probably with grandma or something like that. So I think that's a very remarkable number. And once again, represents opportunity. Okay, this is a couple of other things here that we wanted to know, because I think time of operation is important. And I think this does resemble what we expected. Most people are going to be needing childcare during the normal hours of operation. You know, most people are working in that, you know, morning to late afternoon, early evening time. So 88% prefer a drop off after 6, 86% prefer pickup before 6. However, what that does note is it would potentially create an opportunity for providers that could offer some off-hour times. So I know personally, we work with several factories that are running 24 hours a day. We know our hospital is running 24 hours a day. So those folks that could maybe, you know, provide later pickup times, 24-hour care, it would have to be obviously a very special situation. But something to think about, that there could be times to expand those hourly offerings. And this is actually just the employers. So this was remarkable. To go back again, so this was the community, what the workers mentioned with employers, but this was just the employers. So you see that number perks up quite a bit. Now it's 17%. So this is where I think it's reflected that the employers wish there would be broader hour offerings to be able to accommodate their workers. So I just thought that was kind of an interesting scenario there as well. So very brief presentation. I think what this says is there's market demand. We know there needs to be more availability of childcare. Pricing is everything apart from the pandemic. We know that's a major factor for everybody. It's a challenge for everybody, but it does come down to money. And what I have heard loud and clear, particularly from many of our existing providers, as we've had these conversations over the last many months, is access to talent, access to workers is a problem. And everyone, once again, has that problem right now. But, and I'm just going to generalize here, because the money flowing into the child care centers is low, you know, parents are not paying a lot per week, that trickles down and basically means that employees cannot be paid a lot. And so, you know, once again, if you're only able to pay $10 or $12 per hour, it's very, very hard to get good people. So how do we deal with it? Clearly, the answer here has to be getting more money into the system. There's got to be more dollars that flow in to support the operations, to be able to pay workers more money. And I think there's a couple ways you can do that. Certainly, you know, looking at, you know, pay of, you know, of what parents pay is something to consider. But where I'm driving toward, and what I want to be able to do, and our organization wants to be able to do, is bringing employers into this conversation. Coming full circle from where I started here, employers want to attract and retain talent. And the reality of the situation is they need to do things to provide a better place to work, to become an employer of choice. Yes, that includes things like paying people more an hour. But what we have been talking with companies about is how do we look to childcare benefits as an enticement to retain and attract workers. Bottom line, how do we create an environment where companies are literally investing in childcare, where they're partnering with providers in the community to be able to somehow subsidize that childcare that will help create a happier worker that will want to stay with that employer, that will be able to come to work because they have reliable childcare. So I think that, to me, is the game changer. What maybe some folks have not thought about in the past. Certainly there are state and federal monies that are flowing out there, and that's going to have an impact and a benefit. But long term, I truly believe that our employers stepping up and investing in childcare and supporting our centers is the key answer, the key solution, not just for Shiawassee County, but quite honestly, I think it's an answer statewide and nationwide. Is employers need to invest. And I will say, for those that don't know, in addition to attracting and retaining talent, there are other financial incentives for employers to do this. For example, there's actually a federal tax credit that companies can get if they put money toward childcare. So it's a tax write-off, basically. So that's another enticement that's out there. So that, once again, is the role we want to play. We brought employers to the table. Several participated in the survey. Several are ready to go. They need to understand, though, how that partnership works. How do we create something, a linkage between those companies and between our providers to get that money flowing? And so, and this is a pivot now to Cheryl and what she's going to talk about. And we actually have James and Mike here as well from the organization who can also comment. But in order to figure all that out, in order to create that structure where our providers can actually get those collaborations going with companies, I think there needs to be some assistance for our providers, assistance for our companies, but to help them understand, what does that business plan look like? What does that financial model look like? Is there money available to facilitate something? If I need to expand my facility or modify my facility or do something different, how do I put all of that together? And this is where our friends at the Small Business Development Center, Cheryl Peterson, our Shiawassee County consultant, and friends at First Children's Finance come in, Mike and James, who are on here. They now have the ability through our Small Business Development Center to provide access to that planning, that consultation at no charge to our local providers. So what I'd like to do now is turn it over to Cheryl and Mike and James, who are on here. Feel free to comment, but to help everybody understand what those resources are to support our providers, to help make those connections and to help your operation. So Cheryl, with that, I'll turn it over to you.
Thank you, Justin. And I would confirm very clearly a comment that Justin made a few minutes ago about this issue not being unique to Shiawassee County. What we found from the Small Business Development Center is that we have heard this repeatedly across the state, from home-based providers, center-based providers, the issues surrounding the care of children. As a part of the CARES Act, which was one of the stimulus packages in 2020, there was a certain amount of dollars given to the small business development centers across the country to bring some services to their communities that would typically not be available. And one of those services was in the area of childcare. So the organization that the SBDC, the Small Business Development Center, has partnered with is First Children's Finance. And I want to give you just a little bit of history about that organization in case this is the first time that you're hearing about them. They began their work in 1991 out of the Minneapolis-St. Paul area, but they have had a presence in Michigan since the late 2000s, about 2008. And their whole purpose is to create sustainable solutions around the issue of childcare services and childcare providers. And they have the ability to work at several levels. They work with individual providers, They work with system providers, and they work on a large strategic scale with a community-based solution to childcare issues. The one that they are teamed with us, with Small Business Development Center, is to work on a consultant basis with individual providers, home-based or center-based. And the program that we have set up with them that can come to you as an individual provider at no cost is 10 hours of consulting services around a variety of topics. Those topics could be your rate structure, doing an analysis of that, your contract policy, taking a look at those contracts and what's included, what should be included, a marketing program for your facility, a review of your business plan and future goals, an analysis of your monthly revenue and expenses, and maybe where there's opportunity there for improvement. And then the one that we've been focused on tonight, staffing and enrollment assessment and issues. Now, how does that work for you as an individual provider, if that's attractive to you? It would be a brief conversation between you and I, and how the Small Business Development Center is facilitating this. You become a client for these services, and then you are connected with First Children's Finance. There are 10 hours of no-cost consulting services made available to you on the topics that I have just briefly discussed. If you find that at the end of that time, the 10 hours has not been sufficient, there's the opportunity to reapply for more consulting support from First Children's Finance. So again, if that appeals to you, if you have questions in those areas, you need to talk with someone in some of those areas, then reach out to me and we will get you through our statewide services process so that you can take advantage of those 10 hours of no-cost consulting. On a larger scale, they are also available to help us as a group of individuals and businesses and employers to think through the process of what is a community-wide or a more strategic solution across the Shiawassee community. So I see kind of two buckets here. One is an advantage, a service for individual providers, and another is a facilitator that can help us all as a whole determine how we can best address this need on a community-wide basis. So I'm going to stop there because I want to give James and Mike an opportunity to add any other comments that they have on either their services to individual providers or the role that they might be able to facilitate in a community-wide solution. So gentlemen, we turn to you.
Well, good evening, everyone. And I really appreciate that update and that insight, Justin. And thank you for your very kind introduction as well, Cheryl. You are absolutely right. And it's an honor to be with you all this evening. I'm James Henderson, and I'm the Michigan Director at First Children's Finance. And Mike Ty is with us this evening, and he is our outstanding business development specialist. Some of you may have actually worked with Mike previously because he coordinated the state shared services outreach and programming and across the state. So very happy to have him with us at First Children's Finance. Everything that was in your presentation and your PowerPoint, Justin, and what you're talking about, Cheryl, is what we deal with. And to your point, since 1991, coming out of Minneapolis, St. Paul, Minnesota, we represent the Michigan tier. We have been in Michigan since 2008. And if we go back to March of last year, the sector, as Justin was already describing, was struggling. And if you go back outside that data, approximately 10 years, we have been slowly losing providers, home-based and center-based, for various circumstances, various scenarios. And then you bring forward the pandemic. Well, it just put the sector on a national spotlight in addition to our state and to even county level and local community level. So the race is on literally to support, maintain, sustain, and grow as many businesses, home-based or center-based, as we can. We know our data is telling us right now that we are somewhere around, and the data goes back and forth, but we know prior to the pandemic, we were hovering around 8,500 businesses that were registered in the state in one form or another in terms of licensing or credentialing. We know right now we're somewhere around 8,000, and it could even actually be lower. We're working with LARA, we're working with the state. Mike and I serve on several different advisory councils, committees, and we're trying to figure out where we are in the throes of things. What we do know right now is that 90% of those that are still licensed and deeming activity are trying to re-engage the sector. And they are trying to get their families back during this time. And what we're learning with the hybrid school models or virtual learning or workplace and economic development shifts is that either the existing providers, home-based or center-based, that were able to maintain their operations during this pandemic, they're exhausted and their staff is exhausted. And they are now having to, and I'm sure you're hearing about this in your county or your communities, come up with flexible hours that they didn't necessarily think about until this point, just simply because of staffing shortages and the turnover and attrition rates, and to give the staff that have been champions a break and rest. That in turn is causing frustration and angst with the parents and the children, as they are now being charged with returning to whether it's the manufacturing sector or their current employer. And there is a disconnect in terms of the number of quality slots and spaces that are needed at the same time. So as Justin was talking about the data and the percentages, they pretty much mirror what's going on across the state. And I was very pleased that you actually undertook this study, because it indicates to Mike and I that you're being proactive, because a lot of the counties and regions are right now struggling to try to get a feasibility study, which you just presented in terms of their next steps. So for us, it's twofold. As Cheryl mentioned, we have a wonderful partnership with SBDC. We are statewide with this partnership. It is through CARES Act funding, and it really is a matter of how many providers can we engage. You can be for-profit, you can be nonprofit. We don't look at the size of your program. The only prerequisite for us is that you go through the official process of joining SBDC and being referred through them to us. And that's where Cheryl comes into play. We also know with the CARES Act funding that initially we did have for 10 hours. If there's additional time that is needed, you can actually reapply from the SBDC standpoint and get additional supports from that side of things too. So we really appreciate and applaud your efforts. We customize our consultations based off of what you need. As Cheryl mentioned, we have a list of things that we actually provide through this partnership, but we don't really know until we engage with you what's going to rise to the surface as your immediate and primary need or concern. We're willing to work with you any step of the way. Justin mentioned that there could actually be a tier that are looking at startup or just went through the licensing process, and what kind of supports can they have? Well, we actually have a startup sector tier to us as well. Where we come in compared to family, friends, and neighbors is that because you're talking about federal guidelines and CARES Act funding, you do have to have your licensing and your credentials. But once you have that, you can engage with us and the expertise that Mike and our other specialists bring to the table to customize that level of support. And as Cheryl and Justin are both talking, we actually have a couple different tiers, obviously working with individual businesses, home-based or center-based, to make sure that you have the tools, resources, and the financial analysis and breakdowns of where you stand is absolutely important. What we're also dealing with now, and we're picking this up, is the need from the county and community service action planning to look at how your numbers are panning out right now, the level of engagement, hearing from your parents, hearing from workers, the employers, and trying to figure out the best solution plan that has everybody that's invested in the community and the counties that you serve thinking smarter and not harder in terms of the approach and the innovation that can really come out of that. And some of the things already, and we'll debrief with Justin and Cheryl in terms of some potential next steps. But you could tell from that data, it was pretty apparent that employers are trying to figure out flexibility for hours. Providers are trying to re-engage, offer that flexibility, and for parents to come back to their programs. So there is a natural synergy that if it had a little bit more structure, a little bit more guideline, could be a natural flow to make sure that you're addressing those percentages. Individually, you're seeing that you're somewhere between 20–30% in terms of engagement. Collectively, that could shoot a lot higher, and if it had an umbrella pulse or some kind of structure behind it, would make you more enticing for public and private funding and long-term sustainability. So, Mike, I'll just simply give you an opportunity if there's things that you wanted to share as well.
Thanks, James. Excuse me. And thanks, Justin and Cheryl, for having us. I'll just share a few things about working with providers one-on-one, that we just meet you where you're at, wherever that may be. So we know you're very overwhelmed. We know, what's going on in the sector across the state. We're learning exactly what's going on in your community, and it's not different from a lot of areas. And so don't be intimidated. We're going to jump right in, and we're really just going to learn what those pain points are and then how we can best support you. I always like to break it down very simply for providers, so I'm not going to throw any crazy jargon or anything at you, and it's going to be really a safe space. So I always like to just kind of echo that and share that. But we're here to support you. We're here to help, and we're here to try to use some innovative ideas and work with community partners just to strengthen everyone. So again, just wanted to say we meet you where you're at, and echo everything James and Justin and Cheryl did. So thanks for giving me a moment.
Great. Cheryl, anything else you want to add right now?
No, just thank you to James and Mike for their comments, and glad to have them with us tonight. And again, if there's an individual provider who's interested in more information about the services from First Children's Finance, they can reach out to me at my email, cpeterson@shiawasseechamber.org. And I'll be glad to talk with you in more detail about the CARES Act and how this funding can be made available to you for those 10 hours of consulting services.
Cheryl, one last thing that I want to say right now is that, as Mike mentioned, we understand that everybody is just going through either a range of emotions or absolute exhaustion right now. One of the things that we have at our disposal through this wonderful partnership is, again, this is not something that you're going to have to come out of pocket for. It is a matter of you taking the opportunity to take advantage of these resources. And I'll be very transparent. This partnership right now with the CARES Act funding goes through September. So the sooner that we can engage with you and get to work and support your efforts, no matter where you are, as Mike said, in the spectrum or the pendulum of your business, we want to help you come up with solutions and strategies to come out of this pandemic, to get your families back, to market and entice your business to potential new families, and to really have a handle on your numbers. And I'll be honest with you, the data told us when we had this pandemic first unfold, we had a situation that, as you all know, when funding was coming from federal guidelines down to the states in terms of PPP and PPE, we hit a bump in the step there. And what I mean by that is we had a lot of providers, home-based and centers, that actually missed out on funding because they did not know their numbers. Justin had mentioned it earlier about the fact that in order for you to know what you can do and what you can deal with in terms of your families and your children, it is all about understanding your numbers, having confidence in those numbers, and being able to have projections and break-even analysis. Unfortunately, many providers were on their heels and they honestly got rejected. for that first round of the funding because they didn't have the knowledge, they didn't have their paperwork together, and they couldn't address some of the questions. So it's about the financial side of it. And as Mike said, this is not a judgment on anyone. We know that a lot of providers, for them, they don't even think of themselves initially as entrepreneurs. It was circumstantial, but that is not an excuse for us not to get to work and help you where you are and talk to you in language that can have you have confidence and have success. We just want the opportunity, and it just is a matter of your time and consistent engagement through this process.
James, can you maybe walk through a scenario for us, how you might be able to help? And I'll kind of paint the picture because we have something kind of we're working on with right now. And some people on this call are aware of it. What if we have someone, a provider that is interested in partnering with a company? They need to understand, obviously, how to make that happen, though. So you've got the provider, you got the company, they have workers, they have kids. There's interest on the provider. How do you help them pull all that together and figure out what each party has to do?
That's a wonderful question. And what I can tell you, Justin, is we have extensive experience in this sector. What typically happens, especially in rural communities, and you had referenced about manufacturing sectors as an example. And one of the things that I love to say in this kind of situation, Justin, many people think that a deficit or a child care desert exists because you have to have between 5,000 and 20,000 slots. That is far from the truth. You can be in a community and be devastated or crippled if you can't even provide 50 slots and give the flexibility for that local primary, either construction, manufacturing, whatever the industry is. So if you have somebody that's saying on the provider or business side, hey, I'm looking for growth, I'm looking for expansion, I'm looking to extend the number of quality slots that I have, but maybe doesn't necessarily have that background and that expertise, or doesn't even know who that local or regional business or partner is. Then on the other side of it, we were saying this early in the conversation, what if you have somebody that is an employer that is getting hit hard about the fact that they can't retain their workforce and their staff because of lack of quality childcare? That is a natural synergy between that provider who is apparently willing to cover and staff and operate a business with an employer that might not understand the licensing, the credentials, the side of what childcare operations entail, but may actually have a bigger location within the actual manufacturing center or the structure, or could build something out where it could actually hit that capacity and that need. So it is bringing them together, looking at the current scenarios for both the employer and the provider, and looking at what is the best fit and how that is structured, and who is liable and responsible for what, and what are you talking about in terms of tuition, or if subsidy comes into play, and other variables. But it is a feasibility in terms of what could be for that community, and a plan that is strategic and has everybody invested for the stakeholders to make sure that it's successful. So it is definitely mirroring between the two to see what the need is, the number of quality slots that are absolutely needed, the flexibility in the hours, and then making sure that you have a strong quality program with staffing and resources to make sure that it's enticing for, one, bringing out the center, but two, that the employers will take advantage of it and use that to get to work and know that they have quality coverage and outcomes. So we have very extensive knowledge into this, yes.
And where does your First Children's Finance, obviously, where could capital play a role in that scenario from you guys?
It's a wonderful question. We actually have a loan fund ourselves, but out of this action planning and scenario planning, in addition to ourselves, is a possibility of some kind of funding or some kind of capital for investment or improvement structure. We actually help to raise the bar that makes it possible to make it more enticing for other private and public partners as well. And if it is not just us, we have a lot of vast contacts and connections where we would help to facilitate that dialogue with the appropriate stakeholders, because the whole thing for this, Justin, is predicated on not just one thing where you're like, great, we're together and let's see how this goes for a year. We're invested, and we hope the community is invested for long-term solutions. because the only way you're going to be able to impact economic and workplace development is to have resources that are going to be around for years to come. So we bring something to the table. We can also look at other partners and other resources for funding, but it's also about how can you do this through the strategic planning to make sure it has long-term stability.
Great. I see we had a question here. Oh, it's from Kristen. How can I get the information? Okay, Cheryl, yep, you did respond. Very good. Thank you. Oh, yep, and Mike's passed along some information in the chat as well.
Yep, I shared a simple flyer we put together with partnership with SBC that has the contact information too on there. So feel free to share that with providers in your area, far and wide.
Great. And that's the goal here. Want to share that, share the presentation, share the copy of the webinar with those that were not able to participate. So we'll do that obviously after this meeting. Are there other comments or questions? Oh, Kristen sent a note. I said I cannot download. Any comments or questions from anybody? We have a good turnout tonight. Anybody that's not talked yet want to comment or ask a question?
This is Laura from the YMCA. I have a quick question. If we're looking at potentially offering childcare that would be subsidized by an employer or a couple of organizations, are you aware of a model that might be out there where a center, has that type of subsidy? Obviously, it would be much easier to expand hours and really fine tune what a larger employer may need. But I'm just curious to see if there are models out there, whether in our state or another state.
Laura, this is James. That's a wonderful question. And yes, there are models that are in existence and they are happening. And I will say this, First Children's Finance, we mentioned about us being in Michigan since 2008, but we actually have scope of work across 20 different states. And especially during this pandemic, we're getting outreach from even more. Yes, there are models that are in existence that look at subsidy, tuition, how you're actually structured, how it can actually be feasible for growth, expansion, new location, strategic marketing, analysis of where the children are, where the families are, what the bracket range is. All these different things are in existence. So there are many models. And one of the things that we can do as we dive deeper into this is we can do more research. Obviously, this is a base call for us right now, but we would love to be able to bring those type of models together. And we also have another website, and it's hard. Mike knows where I'm going with this. We actually have another website within our primary First Children's Finance website. I will get Cheryl that link as well. And Laura, you may appreciate this, but we have a whole nother track that really looks at what we call this community action in the rural child care innovation and the programming, where you can see some of those success stories as well.
Thank you.
Beautiful.
My pleasure.
Great. Thanks, Laura. Anybody else want to jump on? Any comments, questions? We were probably hoping to keep this to 1 hour, and we're 8 minutes short of there. So I think we've been pretty efficient with our time. Any final thoughts from anybody before we wrap up? Obviously, this is a team effort, just like economic development. We have a lot of great, just tonight, we have a lot of great community partners on, and for us to find these solutions, it is working together as a community. I personally am very excited about what the Small Business Development Center and James and Mike, what you can offer to First Children's Finance. I think the pieces and parts are all there. I think we've got the companies, we have the identified need, we've got providers that want to do something. You can bring the linkages to make that happen, to put it all together and hopefully start to provide some solutions. So I'm really excited coming out of this, what can happen. So I would say, to wrap up, in order to get engaged, for anyone that's watching, I would point back to you, Cheryl. They would want to get a hold of you to get that process started. Is that right?
That's correct, Justin. And again, you can email cpeterson shiawasseechamber.org.
Great. And when I send out a follow-up email to our whole contact list, I will put that email address in there and tell people to get a hold of you. So hopefully, obviously, those that are on tonight are very interested and engaged. For those that were not able to participate tonight, check your email and we'll definitely get you the follow-up information and get a hold of Cheryl. So any final comments from anybody? Any final things for the good of the order?
Justin, one thing I'll say
Sure.
in closing is that it really takes a lot of concerted concern, passion, and dedication for your county and the community and the populations that you serve to even undertake that feasibility study with Childcare. And the thing that I'm hearing from this initially, and we'll certainly talk more detail afterwards, but you have done already a lot of the legwork. And most of the time with our community action planning and our studies and our strategic planning, you're trying to see if you can entice an employer. You're trying to do a scope of research to see if a provider is interested. You are trying to look at data to figure out the last time that a survey was done, or maybe you're at the origins of starting one. So what I will say is kudos to all of you that participated. You're further along than what other counties currently are. And there are 83 in this state. So I am saying that you are ahead of the game. And again, it's about working with those collaborative partners that want the best for your community, the providers, the employers, workforce, quality outcomes, and the parents. And how do you actually pull that together? And we just look forward to having even more conversation.
Awesome. Well, thank you, James. Thank you, everybody. I think we'll go ahead and wrap 7:55. Appreciate you taking time on a night to be here. Hopefully you found this informational and very beneficial. And as Cheryl said, she is our contact person. If you want to get engaged, please follow up directly with her, cpeterson@shiawasseechamber.org. So thank you all for being with us tonight, and hopefully we'll talk to you all very soon. Thanks, everybody.